Hello everybody, my name is Greg Bran. I'm a facial plastic surgeon based in London, UK. Today I want to talk about a topic that I get a lot of questions, and this is how the nose and the lips interplay when you have nose jobs and then lip surgery, or if you have a lip surgery, does it impact the nose, etc. So there are three things I want to discuss in this video. First and foremost, the connection aesthetically between the nose and the lips. Secondly, I would like to discuss what happens if you have a nose job and how this can affect your lips. And thirdly, what happens if you have a lip lift surgery and does this impact your nose? So firstly, let's talk about the aesthetics between the nose and the lips. I use another example to help you understand what I mean with that, and this is the aesthetic line called the brow tip line. It's this kind of extension of the contour between the brows that goes all the way to the tip of your nose. And ideally this should be symmetrical and in some way harmonious in order to emphasize the overall balance of your facial features. Now, doing a lot of lip surgery, I also looked at the nose and how the nose actually plays with the lips, and I came up with something that I call the TLC, the tip lip complex. And what I mean is, similar as we have the brow tip line, we also have another line that goes from the tip of your nose across the philtral columns. These are these two little lines in the middle of your lips, all the way to the wings of your lip. And this again creates another flow of harmony between the nose and the lips. This is important. We did some research on this, and that emphasizes the importance for this area that we call the philtrum. If the philtrum flattens, which happens with aging, you lose the TLC complexity, and with this everything looks longer, disconnected and less aesthetically pleasing. So there is a strong connection between the nose and the lips just for purposes of aesthetics. Now let's talk about rhinoplasty. Rhinoplasty can change the overall perception of your lips. Why? One reason would be you have a droopy tip. As we raise the tip in order to create more balance on the nose, it exposes more of your top lip. So some patients that had a very droopy tip and the tip came up suddenly feel like their lip has elongated. Well, it didn't really elongate, but you just see more lip. The real estate of lip became more visible, and therefore they are becoming more self-conscious about it. And sometimes I have to tell them everything is fine, you don't need to worry about it. And sometimes the lip is a little bit too long and needs some surgical improvements. Another reason for a change on your top lip after rhinoplasty could be the surgery in itself. Depending on what needs to be done on the base of the nose, sometimes there is a lot of dissection into the area of the lip muscle, which can cause a drop on your lip. And every now and then I see patients that come to see me and say, my lip has dropped after rhinoplasty, I can't smile as I used to be, and it just changed. And these patients will benefit not only from a lip lift, but sometimes we have to resuspend also the lip muscles to the base of the nose in order to restore the anatomy as it was before the rhinoplasty. Let's talk about scenario number 3. I'm having a lip surgery, will my nose change? Well, this is a question that I get all the time, because a lip lift goes all around the way from one nostril to the other. And a lot of patients like the nose, maybe because they had rhinoplasty or because they were just born with a pretty nose, and they do not want to have any changes on the nose. So in my close to 10 years of lip surgery practice, I haven't had one case of a patient telling me that their nose has changed. And there are certain steps during surgery that I can use in order to counteract any changes to the lips. But I always say medicine is not mathematics. 1 + 1 is 2 in London, New York, Miami, Bali, the Mars, everywhere. I can perform 110 surgeries just the same way, and the 111s might heal differently. This is the difference between mathematics and medicine. In my hands so far, no change has occurred on the nose and the width or appearance, but it can always happen. And every patient that comes to see me for lip surgery has to understand and accept this minimal risk. So there's no 100% guarantee, but it's extremely unlikely in the hands of somebody that has a fair amount of experience with this surgery. Thank you very much for watching this video about the correlation between the nose and the lips. I hope you had a chance to learn a little bit about it. If you want to learn more about aesthetic lip surgery, which I love to do and perform a lot of, feel free to contact us via DMing on Instagram, TikTok, YouTube, or just go to my website www.gbalondon.com. Call us. I'm looking forward to speak to you and give you some more insight on your lips. Thanks.